So let us discuss why extension is the safe position for IP joint splintage. So there are a couple of reasons. Let us see them one by one. Some are more important, some are less important. So firstly, it prevents the contracture of the volar plate. As we know, the volar plate is a strong ligamentous structure at the volar aspect of the IP joint. So when we immobilize the joint in flexion, it can result in shortening and contracture of the volar plate, which results in flexion contracture of that particular finger. So when we splint in extension, this complication is avoided. Secondly, there is avoidance of collateral ligament tightness. So the collateral ligaments of the IP joints are taut in extension and they relax in flexion. So when we immobilize in extension, it prevents the ligamentous shortening and preserves the joint mobility. In addition, when the IP joints are splinted in extension, the flexor tendon maintain a functional length tension relationship. So this also reduces the risk of tendon adhesions and the stiffness which might cause because of the prolonged shortening. Then immobilization in IP extension also maintains the joint space. So this is more of importance in the MP joints, but of a lesser importance in IP joints as well. Splinting in extension is a much functional position, and when the splintage is removed, the rehabilitation is much easier, much faster, and relatively less painful. So these are the reasons why IP joints should be fixed or rather immobilized in extension. In addition, it also sort of prevents developing of a swan neck deformity. There might be certain exceptions. There are rather certain exceptions to this rule. So whenever a flexor tendon is repaired, IP joints are to be splinted in flexion to protect the healing. But otherwise, as a general rule, the gold standard for IP joint immobilization is extension. Thank you.